There has been no effective way of stopping the spread of COVID-19 in Mississauga, a city that remains in one of the hardest hit regions in the country. The mayor says with an inability to control the numbers, hospitals are over capacity, and what was a thriving business community is now struggling to survive. We speak with Mayor Bonnie Crombie in a one-on-one year-end interview. With high positivity rates and increasing case counts, more than 150 rooms in Mississauga's hospitals are now being used for COVID-19 patients, and that has already had dire consequences on the healthcare system.
That means a number of elected surgeries can't go forward. Other people aren't getting the kind of treatment that they need.
Mississauga's proximity to other hard-hit cities has made it difficult to bring numbers down this year. There are 133 cases per 100,000 people in Mississauga. Compare that to neighboring Brampton, where that number doubles to 300 cases per 100,000.
Because we are one public health unit, we are all in lockdown together. But that is to say the virus travels.
Closing during lockdown has been devastating for the city's lively business community. Local retailers and restaurants were thriving until they were shuttered. On average, small businesses earn 50% of their profits during the holiday season.
It has been very dire for many of our small businesses. Many will not reopen.
Meanwhile, big box retailers have remained open.
That to me seemed fundamentally unfair and gave them a competitive advantage. And we know they've been making record profits, and many of them are not based in Canada. Those profits are exported, while our own small businesses, who are run by our family members, by our community members, by our neighbors who give back to our communities, had to shutter for the holiday season.
The mayor fighting for them to only sell essentials. In response, the province promising it will instead offer more supports for small businesses. The mayor says other tools are needed to help the community and essential workers get control of the virus. With a workforce that is largely considered essential in Mississauga, she's been pushing higher levels of government for sick pay benefits.
Some of those people, when they are sick, continue to go to work because they need to feed their families, and they don't have adequate benefits.
Knowing everything that you do know now about the virus and the pandemic, is there anything that you would have done differently?
Remember, in the beginning, we didn't think masks were necessary. So our learning evolved, our knowledge of the virus and how it spread, how it was transmitted evolved. And so we were able to put those best practices into place.
Despite the darkness, she has seen a lot of light this year.
So it's the way the city came together. They demonstrated their community spirit. And we really shone as a city, notwithstanding the challenges that we have faced.
Looking ahead to the new year, the mayor says her goal is to get residents vaccinated, reopen the city safely, get people back to work, and restart the economy. She is hopeful that by the end of 2021, life will have returned back to the normal we once knew. For City News, I'm Yazdani.